patient. I'm going to be your nurse today. My name is Brittany. Can I get your name and date of birth? I'm going to check the wristband. Yep, that matches. Let me check your provider orders. Okay, it says you need a Foley inserted today. So what that is just a small tube inserted into your bladder to release any urinary retention that you have going on. So, I have Linda with me today. She's my assistant nurse, so she'll be on that side. And she has a flashlight just in case I need any extra hands. And then I'm gonna go ahead and lift her bed to a working height. I'm gonna go just above my waist so it's sterile, maintains sterility, and it's pretty high because I feel like they're tall. Okay, that's as tall as it goes. And so Linda will lift that rail. I'll lower this, but it's already lowered. I'll wash my hands, put gloves on. So I'm just gonna get you into a nice working position, but try and maintain some privacy. And I'll just drape to maintain as much privacy. And so for positioning, I'll lay the head all the way down, which it is, and I'll position each knee on the opposite side of each other. The dorsal recumbent position and rotate their hips out. So first, with my gloves on, I'm gonna have Linda hand me some wash rags, and I will go ahead and inspect and then wash front to back with a different side of the thing. Front to back until it's completely cleaned, and then dry it off, and then Linda can take those. And then I can place her on a waterproof pad. Okay, and I'll keep everything that is not needed covered, but this is what I need right now. So I can start opening my sterile, or my Foley kit. So first of all, I'll take it out of its bag, which is kind of messy. First thing I'll do is make this into my garbage can. And then I just need to find where the front is, so it'll be that way. So I'll open it away from me. And then the sides. And then towards me. Okay. And then not touching it, but I'll just move that 1 inch that's going to hang off the end. But when I want to put my gloves on, I might as well just put them over here because I don't have enough room over there. Or I'd put it on another desk, but I can't, I don't see it. So, okay, so I'm going to touch the inner cup and not the outside at all, which is super tricky because these are sticky. Okay. Okay, and then I'll just get this out of the way. Now I can apply my sterile drapes. I can touch them because then my hands are sterile. So this is the first one. The shiny side will be down. And I'll make sure not to touch anything that's not sterile. And then my fenestrated drape, which is also sticky. Normally it would just fall open, but it needs some love. And okay. Okay, so then I can hold it in a way where I'm not going to touch my patient unsterilely. And then I can apply there. A little crooked. So now I can take out my iodine, get my cotton balls wet, throw that away. I can open up my specimen container, just loosen that a bit, set it aside. I am going to squeeze out the lube that I have, even though it's already been squeezed out and there's some left. Throw that away. And then I don't have water in here anymore, but I have air, so that can work. Not in real life, but. And so then I can move this to the side, and I'm within my 1-inch border. And then move into the side, which is also in my 1-inch border. And I would have unwrapped this guy and then pulled it out like this, but I lost the blue wrap. Okay, once that's unwrapped and out of its blue sheath, then I can attach my water. And then I can attach the port wherever it's hiding. There it is, okay. Okay, and then once those are attached, then I can get the lube onto the tip of my catheter. For a man, it would be almost the entire length, but since the female is a shorter urethra, we'll just do a little bit. And that seems pretty gelled up, so I can leave this nice and wrapped in here so it doesn't want to jump out. As much as possible. Okay. After that's done, I'm going to move my whole unit to my sterile thing here. So then I'd have Linda point the flashlight here, and then I'm going to contaminate my hand. I'm going to hold the labia open. Since this one's not contaminated, I'm going to move this down. It's just getting so in the way. Then I'd hold the labia open, wipe front to back with one swipe, then the side with one swipe, and the other side with one swipe. I'm just going to get rid of that. And here is my catheter, so I'm going to tell her to bear down, and then I see the wink at me, so then I'll insert it. There we go. 1, 2. It's just having some tough time. Normally, if there's this much resistance, I don't know why, because this is very lubed up. Oh, okay, there we go. I'm just having better fingers. And I'm gonna do my best not to touch. Okay. That's well over. So I would insert it 2 inches, wait for urine, and then I'd insert another 1 to 2 inches. And then I can grab over here and then stabilize it, and then insert the water, but this time it's air because I don't have any water. Then I'd ask, as I'm doing this, if the patient has any pain, and so then we can look. And then look right in here. Do you see the balloon? I don't know why the balloon. So then the balloon would be inserted. Okay, so that's good. Okay, so normally I wouldn't have taken my sterile hand off, but I had to. So, balloon is inserted, and I'm gonna squeeze this off. Now I'm just gonna tug on it. Okay, then there's resistance. So then I could rip that drape off and attach this to the thigh. Once that is attached, then I can take my gloves off, and then I'm gonna grab my setup, and then I'll hook this to the frame of the bed and not the rail. There we go. There's a nice little hook for it. So then I'm gonna wash my hands and then put more gloves on, new gloves on. And then I can carefully open my container, open the thingy, and then fill it up to 20 to 30 mLs. And then close it sterilely, don't touch the lip and don't touch anything inside. So then if I don't get any output or an output less than 30 mLs in an hour, then I can contact the provider if I'm positive it's in the bladder and stuff. But after that, then I can just, put everything away. I'm gonna have Linda get me another wash rag so we can wash off the iodine. And I'll ask if she has any pain. No, and then I'll palpate the bladder. That's good too. And then, so once I get all that stuff put away, I'm gonna put her into a more comfortable position. I can keep this, but not this. And then I can position her wherever she wants to be, and then, pull the blankets back up over and put the bed down, and and then lift the rails if they want, and then she's got her call lights. Then I would document the size of catheter I used, the type of catheter I used, the reasons why I decatheterized, the amount of fluid in the balloon I inserted, and then the amount of urine that was collected, characteristics of the urine that was collected, INOs, and the teaching I provided, and then the patient's response to the teaching. And that should be it.